Bye.
Hey everybody, this is Marcy Steed and welcome to Health IQ. So for all of you out there, there are these moments when stress gets you going, when you're really trying to figure out what that headache is really all about. And there is a phenomenal healer and doctor who has continued to be there for our community. That is none other than Dr. Frita. Hey, Dr. Frita, how are you?
I'm great. How are you doing?
Well, it's exciting. I'm fantastic. And COVID is still present and aware and in this community.
Absolutely.
Nephrology, why did you decide as a Black physician when you could have done something different? Why nephrology?
I'll tell you, now my original plan was not nephrology. In fact, I wanted to be a primary care physician where I could take care of families from the infants all the way to the end of life. That was my plan. And so I went to Meharry Medical College, historically Black college and university. And then I did a double residency in internal medicine and pediatrics so that I could take care of everyone. But then I fell in love with the kidneys, and I'll tell you why. Number one, I like the physiology of the kidneys. And back in medical school, we used to talk about the kidney, the nephrology course, and how complex the kidney is and how a lot of people didn't do well in that topic. And I love a good challenge. So I sat right there in the front row and it happened to click. But then even more importantly, when I started to do my clinical rotations and I would go to the dialysis units where people had kidney failure, almost all Black people. But then I would go to the transplant clinics with the life-saving gift of life of a kidney donation, almost all non-Black people. And these were people who had a less challenged socioeconomic status. And that's when I realized there is a place, because the top two causes of kidney failure are diabetes and high blood pressure, two diseases that are preventable or at least treatable, and two diseases that really plague the Black community. And so I felt like I could have a voice, especially among people who look like me, who talk like me, where I could make a difference in the community.
So just tell us why. You're sitting there, you have an option. Why should we be concerned as a community? You talked about it, but what are we missing? Why are we a larger number there?
Well, there's so many factors. Some, sure, it could be genetics, because if you have a family history of diabetes, that can put you at risk. Same thing with high blood pressure. But also there's a big lack of access to healthcare, because with high blood pressure and diabetes, you can have these diagnoses and have no idea. You know, you can walk around with the blood pressure that's sky high, but because your body has adjusted and gotten used to it, you may tell yourself, oh, that high blood pressure is normal for me, or Auntie Susie or Uncle Bobo had high blood pressure, it's normal for me, but it's not. Just because you have no symptoms, it doesn't mean it's normal. It's still doing damage on your kidneys, your heart, on your brain. And so there's an education piece, there's a family history piece, and then the access piece. If you don't have a doctor who's sitting there and letting you know what high blood pressure is, how you can lower it even naturally to prevent high blood pressure, then you won't know. If you cannot afford the blood pressure medications, because many of them are very expensive, and you have to make a choice between blood pressure medications versus feeding your children, well, the choice is going to be, in most cases, feeding the children, and you put yourself to the wayside. Same thing with the diabetes. Asymptomatic, a lot of people don't have symptoms. And then the way that we eat, especially Black people as a culture, that good old fashioned soul food, much of it that's high in salt, high in fat, high in carbohydrates, that food can put you at risk for having the diabetes and the high blood pressure, which can sit you right in my dialysis chair with kidney failure.
So for those individuals that are young and they imagine that they can't get diabetes at a young age, what should we all be testing for?
So the good thing is that when you go to your doctor, the tests for diabetes or even high blood pressure, it's a part of the routine visit. And so in that basic metabolic panel, or BMP, you have your blood sugar tested, or your glucose. And if you get those labs where you're fasting, meaning you had no food or drink for at least 6 to 8 hours, then that will let you know what your fasting blood sugar is. And if it is greater than 125 consistently, certainly on 2 separate occasions, then you have a diagnosis of diabetes. And if it's greater than 200, even if you've already eaten something randomly, then you also very likely have diabetes. There's another test, the hemoglobin A1C. That's a blood test that is not just like the blood sugar, which is a quick snap, a little snippet in time. The hemoglobin A1C actually gives us the average of what your blood sugars have been over the last 3 months. And they can let you know if you're pre-diabetic versus if you're diabetic. Because I know sometimes I'll have patients and they'll have a high blood sugar. They'll be like, oh, you know what though? I had a donut for breakfast. That's probably why. That could make the blood sugar high for sure. But if that hemoglobin A1C is high, it's telling me what your blood sugars have averaged over 3 months. And so that's really the more telling test.
So we get it when we walk in. It's a basic test. They test for our blood pressure. And we're not going? Are we not going, Doc? Are we not really making the visits, or we don't have access? Obviously, that's that community. What should we know about making regular doctor visits?
And it's both. A lot of people, okay, so definitely we already know the health equity. Okay, it's not there. So a lot of us maybe don't have access. But even when we do have access, a lot of folks don't like going to the doctor. They don't like doctors, which really kind of hurts my feelings, but I understand why. Many doctors will talk down to patients. They'll speak to them in a condescending fashion. So for example, if you have a patient who comes in and she has an elevated BMI, body mass index, well, so if your body mass index is between 25 and 30, you're considered to be overweight. And if it's greater than 30, you're considered to be a person living with obesity. The thing about the BMIs is that they don't take into account a lot of differences in body types. For example, if you are a Black female and you have dense bones, if you have a heavy or a thick muscular frame, and you may weigh more than someone who is your same size and maybe does not have an elevated BMI, well, now you're labeled as being either overweight or obese. And with a lot of physicians, that comes with judgment. So you may have some very legitimate complaints. You may have a headache you're complaining about, or cramps, or just feeling tired, or just all kinds of things you may complain about. But then if you have a physician who's condescending or maybe toots their nose up and they think it's your fault that you weigh so much, they may just focus on that and say, if you lose weight, then your problems will go away. And that can make a patient feel undervalued. And that happens disproportionately in the Black community where complaints are not taken seriously. The same thing with pain. We have documented studies showing that the pain of people in the Black population not taken as seriously as people in other populations. And so I say that can lead to us having less visits, because who wants to see a doctor who does not value you, who does not take your complaints seriously, and who is condescending, who says to you, well, if you stop eating all that fried chicken and you stop eating all that hog maw, you're gonna have these problems. Now, there's truth in that statement, but you have to remember, being culturally sensitive, if someone says that to me, well, you just insulted everything my grandma taught me to cook, and I really don't want to come back and see you. And so there's a way of getting the messaging out there, communication, and there's a big lack of that for many physicians, to be honest.
But you want to step further. You want us all to know, you want us all to learn, and you have put together a phenomenal book for all of those who really want to, make a difference and educate ourselves even deeper. Why the title, please?
So the title of my book, and I'm very excited, even right now it's available for pre-sale if you go to drfrita.com or to my Instagram at dr.frita, then you can click on the link in my profile and go ahead and get a pre-sale. But the name of the book is Under Pressure, A Guide to Controlling High Blood Pressure. And I wrote it during this time in particular, because of course we've all been living in this pandemic, which we thought would be over by now. It's not. And so we're under pressure in many ways. And many of us have lost loved ones and lost jobs and just lost relationships, have lost so much. And we're under pressure as a people. But just because the focus has been COVID-19 in the pandemic, other problems are still occurring, and high blood pressure is still a leading cause of heart disease, strokes, of kidney failure, of going on dialysis. And so when you're under pressure and you have that stress, it can cause those stress hormones to surge. So you have high cortisol, high adrenaline, the blood vessels tighten, you have high blood pressure. So now you're under pressure from hypertension, which can lead you out of this life where you're no longer able to be here for your family, to be here for yourself. And so we're under pressure. I want us to get out of pressure, and I want us to control our blood pressure. So the title, Under Pressure, A Guide to Controlling High Blood Pressure.
So you put together a guide, which is so beautiful for our community. How do they use it? For all of you out there wondering what I should do, now you know. But how would you guide a family to take this moment and bring this instrument, thank you very much, of under pressure into their home and begin to acclimate themselves to the treatments and the chapters? Do you have any idea some of the chapters that we could actually enjoy?
Oh, you can enjoy all the chapters because I'll tell you, the way that it's written, just the way I'm talking to you is how I speak in the book. I talk about real experiences with patients, and I put things in layman's terms, and I bring up real barriers and real scenarios that I've experienced with people as far as controlling blood pressure. And I'm glad that you mentioned, Munson, as a family, what do we do? Because a lot of times when there's one identified patient, like the person with high blood pressure, then that person's like, okay, I'll cook this for my family, but then I'll have a low salt diet. I'll let them eat pork, but I'll eat something plant-based. But that's not the way to go. Even if everyone does not have the diagnosis, that's the perfect timing. You want for the family to approach it. And I discuss this in my book. You want the whole family to have the majority of their calories be plant-based. You want the whole family to understand that having a low salt diet can prevent high blood pressure, can prevent kidney failure. And so in this book, what I do is when we talk about barriers, specifically to the Black community, I talk about one particular example where I had, and this is early in my career, where I had a lady and I'd given her all of these, rules and do's and don'ts and told her, don't eat too many carbs, don't eat too much salt. And she came in to see me as a follow-up, and do you know her blood pressure was high? And I said, okay, well, what have you been eating? And so she told me about the bread and about the pork that was prepackaged and about whatever kind of Fanta soda or, I was like, so I just let her know, these are not what I didn't tell you to eat these things. I told you to eat those things, and I just let her know, as I thought a good doctor should. But then she explained to me that it was towards the end of the month and her food stamps or her card was running out. And so what she was able to get for her family with her $5, loaf of bread, some bologna, I believe it was, and then a 2-liter soda. And so then having that experience and other experiences like that allowed me to change my angle and change my perspective. Many times we look at patients and it's like, why did you do that? Don't do this, don't do that. And you almost discipline them or you're condescending. But when you pause and you practice empathy, you put yourself in that patient's shoes, well, now you can give that patient a different angle. For example, the patient who cannot afford to go out and get the organic fresh vegetables, you say, you know what? If you need to get those canned salty vegetables, get them, but then pour off that salty water and replace it with fresh water that has less salt. So you just kind of figure out different angles. And I discuss this in my book. I also talk about some of the side effects of medicines that people don't like, especially my young men folks, because many times when men are diagnosed with high blood pressure, they learn that a lot of the blood pressure medications can cause sexual dysfunction. They don't like that. And they will stop taking that medicine if you have not warned them or talked to them. And so I'm very, very straight up in my real practice and in this book. I say, now, not all medicines will cause sexual dysfunction. And even the ones that will cause it, it doesn't cause it in everyone. And so I say, listen to me, please do not stop taking this medicine. If you have an issue with your love life, talk to me. I want you to have a happy love life because I don't want you to be stressed. I don't want you to have, the health problems that stress causes. And so I talk about some issues that I think many physicians don't speak about candidly with patients, but I bring it up in the book and I want to empower people to bring it up to the doctor. Will this medicine cause that problem? If I'm trying to have a baby, is this going to affect my fertility? I want patients to be their own advocates. And I say things in just a real kind of plain language and I bring them up, take the shame away so that people can understand and go out and seek better health.
I love it. For men, just what should they really know about high blood pressure and stroke and the relationship of not getting on meds and thinking that you can bring it down when you've actually gone in a couple of times and you really haven't brought it down? What should they know about stroke and stroking out?
Well, first, what men should know, Munson, is that being sick or having a diagnosis does not make you weak. I think that a lot of men, and very often with men in the Black community, they don't want to go in and be told by some stranger, some doctor, that they're doing something wrong, or they have this problem, or you're going to have this problem for life, or you have to do this and you have to do that. Men folks don't like that, being told what to do or being made to feel that you have an ailment that's going to make you less than. So what I really want men to know, that by not going to the doctor, just because you don't know that you have a problem, it doesn't make the problem go away. It only makes it worse, and it makes it more likely that you really can have some long-term complications and not do well. So let's take the blood pressure, because for me, a lot of the young patients I see, and young male patients I see on dialysis, is from high blood pressure. Could have been prevented. That's, one of the things that's so easy for, especially for kidney doctors like myself to treat, and for many primary care physicians to treat as well. And so I tell them, you have to check the blood pressure and come in. And if you're upset and you think that the high blood pressure medication may cause, you to have sexual dysfunction, wait till you go on dialysis. Wait till you have a stroke. Wait till you have blood clots that affect the tiny blood vessels in your sexual organ. I talk to them just real candidly about those things. Same thing with heart attack, stroke. If you're afraid of a doctor telling you that, hey, you got to eat better, you're at high risk for a stroke or heart attack. If you don't go in, you actually have that stroke. Well, then what happens if you get hemiparesis, meaning your body is actually weak on one side, you can't walk, or your face is drooping and you can't speak the way that you want to. You're afraid of looking weak by being told that you are at risk for a stroke. If you keep waiting, you'll actually have a stroke. And I talk about that in the book as well, where I had a young man in his 30s with high blood pressure. And oh my goodness, I had a chance, he was there for a little fender bender. He was there for one thing, but he had out of control blood pressure. And so I was very happy, I was a young physician then, to be able to tell him how we could get that blood pressure down. But he let me know he didn't need me. He did not need my medicine or my appointments. And he never showed up to the office. He said that he felt good. He played basketball every day. Well, don't you know, some months later, while I was doing a different rotation, this is when I was in DC, I saw that same young male in his early 30s in the ER. And he walked with an abnormal gait, meaning he limped, he was weak on one side. And he was like, "Doc, remember me?" And at first I didn't, because he was a real muscular, strong guy when I saw him before, but he had a stroke due to uncontrolled high blood pressure. So really what I do is I'm just honest with patients. I give them stories, not to be a scaremonger or to, paint some kind of a scare tactic, but it's just the truth. A lot of these things are preventable and you have to face it. It's okay to be scared. Yes, men, you can have fear. But you figure out how to deal with that fear. You show up to a physician you trust. If the first physician doesn't make you feel good, there's not a good communication, it is your right to find another physician, okay? But physicians who care, physicians who explain things to you in a way that is clear, and a physician who helps you to troubleshoot for a special way that may match you and not be the cookie cutter way of treatment. There are physicians out here who will do that. And you owe it to yourself, you owe it to your loved ones, you owe it to your community, men folks, and everyone else, to take care of your health.
So as a family, how should we approach, you gave an example, we want to change the family's eating, natural food consumption. How do we begin that transition so that it's not a overall? How can we transition? And then where are those spots that sodium lurks large that we may not be paying attention to?
Right. So as a family, it starts with introducing your children at a young age to fruits and vegetables. And I'll be honest, with my firstborn child, oh my goodness, I have about 1 trillion pictures of her, not as many pictures of the other ones. I let her have whatever she wanted to eat. Oh my goodness. But with my second 2 children, I introduced vegetables at an early age. And so even now, they have more sophisticated palates. They're okay with trying asparagus, with broccoli, with different fruits and vegetables they never heard of. So introducing your kids at an early age. And if you didn't introduce them at an early age, that's okay. It's not too late. Find recipes, because there's so many now out there, vegan recipes, plant-based recipes. I'm not saying that you have to be all vegan or all plant-based, but find ways to show your kids that fruits and vegetables are not the thing that you say and to get them engaged. And also, when your kids are a little older, allow them to help you, to be in the kitchen, let them cut if they're old enough to cut without hurting themselves, or let them stir a little bit, let them be a part of the process to associate healthy foods with family and with laughter. So that's one thing. And then exercise. Make exercise a family event and make it fun. Don't let it be boring. Exercise does not have to be running up and down the street every day. Now, running is wonderful. I'm all about the jogging and the brisk walking, but it can also be having a dance party, which is something that my family, oh my goodness, my kids and I do that quite a bit. And that's always fun, and it's exercise, especially when you're very competitive, such as I am, and you try to challenge 11-year-olds who are in way better shape than you, and you just end up sweating and sometimes being quite sore the next day. But it's another activity where it's family fun, it's laughter, it's dance, and it's a way to make exercise fun. Even just going out with your kids outside, or adults. You don't have to be a kid to play. You can play adults, husbands, wives, partners, girlfriends, boyfriends, groups. Y'all can say, you know what, let's go play tag. Let's go play touch football, and of course, making sure that everything you do is safe, especially in this COVID environment. But getting out there and playing. I mean, you remember as a kid, kids who had to go inside by the time the street lights came on, they were playing, they were exercising. What they weren't doing is what a lot of our kids are doing now, being attached to video games all day. Pull your kids away from the video games. I'm not saying they can't play, everything in moderation, but these games are so good, and they're in many cases, they are addictive to kids. They're exciting, and it's hard to compete with the video games. And so sometimes as a parent, you just have to be the bad guy. I know I'm the bad guy a lot. And you just have to say, you know what? No more. You pull the gaming device, you pull the phone, and you say, you have this limited amount of time. The rest of the time, go play, or I'll go play with you. So basically making it the family norm to eat in a healthy manner, making it the family norm to exercise. That's what it's going to take to be healthy and to have a healthy family generations to come.
Well, food and the legacy was what was funny about watching the movie Soul Food. Mama died from all those issues, and then the very ending meal they created was just like Mama created, which was the opposite of where we need to be headed. But there are hidden places that sodium and salt is in our diets that we may not expect it or didn't know that it was there. Can you kind of give us some insight on what food to avoid, or as we order our food, maybe ask for no salt? Is that some of the behavior that we should be exhibiting as a community as we begin to understand that we control our diet, don't let diet or even those food providers control us?
Yes, there are definitely foods that you want to avoid, foods that will surprise you that have a lot of salt. But I do want to make a comment on the soul food. I know that I've heard some people say in kind of an insulting way, where they say, oh, I don't eat that stuff anymore. I don't eat pig ears. I don't eat pigtails. I don't eat all that slave food. And they say it in a condescending manner, but I want to comment on the historical soul food. When we know better, we do better. And thank goodness most of us are in a position where we can have food that has, less salt, less fat, that's more healthy. But we have to remember the origin of soul food. Eating those chitterlings, eating the pigtails, eating the scraps, and putting the salt on food so that it'll be able to be preserved. Back in this country, when our people were enslaved, that was not making a bad decision. That was making an ingenious decision, a survival decision. I say that to say, when we talk about the soul food and all the things being wrong with it, yes, we know better, we do better, but in no way does that mean that we're disrespecting our ancestors, or we're disrespecting them. Eating that food is what allowed us to survive, to be here as a people. And now that we know more about salt and about foods that are more healthy, we can still honor those soul food flavors, but do it in a healthy manner to allow us to move on. And so I say that because I know a lot of times people are like, oh, y'all eating all that food. And people get insulted, again, you're insulting people's grandmamas. But now to bring it to today, the food with salt. I know a lot of times when I talk to my patients about salt, they will cut me off and say, I don't add salt to my food. They want us to move on with the conversation. But just because you're not adding salt to your food, it doesn't mean it's not hidden, as you have stated. So if you look at certain things, even something as simple as ketchup, 1 tablespoon of ketchup, some have 160 milligrams of sodium. And what is recommended for most people is having in 24 hours 1,500 milligrams of sodium or less. And that's not a lot of sodium. And just put that in perspective, a quarter teaspoon of table salt, not a whole teaspoon, but a quarter teaspoon of table salt is 590 milligrams of sodium. Now you multiply that out for a whole teaspoon and you're already just about, past your daily limit of sodium. Same thing with a sea salt. I know a lot of people that go, oh, I don't use salt, I use sea salt. Well, okay. A quarter teaspoon of sea salt has 560 milligrams of sodium. Same thing, the pink Himalayan salt, even though it does have some minerals and some magnesium, there's still sodium in there. So number one, be a label watcher and understand that if you are a Black person, if you have high blood pressure, if you have diabetes, if you're over the age of 50, it's recommended that you have less than 1,500 milligrams of sodium. Now, there's some other organizations like World Health Organization and certain kidney societies that may allow you to go up to 2,300 milligrams of sodium a day or 2,000 milligrams of sodium a day for the kidney organization, KDIGO, but no organization says you should have more than 2,400 milligrams of sodium a day. So I want people to start with knowing the reference. When you go over that in 24 hours, you're putting yourself at risk for that high blood pressure, the diabetes, the kidney failure, and so forth. And so ketchup, yes, 1 tablespoon has 160 milligrams of sodium at least. And when people use ketchup, they use more than 1 tablespoon. And so for something that you don't even really think of as a food, just a little condiment, it can be taking you to that level of having too much salt. And then I have people who are like, well, I'm being plant-based like you suggest, and they're, trying to be healthy. And so they'll have the vegan sausage links. Well, in many companies, 2 vegan sausage links, 300 milligrams of sodium. And, when you're eating that sausage, you're not necessarily portioning it out or being controlled. You might have, 4 or 5, 6. And even the vegan prepackaged foods can have a lot of sodium, and I could go on and on. Canned soups, certain vegetables. You just have to make sure you're watching the sodium. Certain lean prepackaged frozen dinners, which may be low in calories, like there's certain prepackaged frozen spaghetti dinners that might have 310 calories. And that's great for having, a low calorie intake, but they also will have over 300 milligrams of sodium. And so even for those of you who don't add salt to your food, you don't use a salt shaker, you really want to be label watchers, watch the sodium, and make sure you consult with your physician to find out what sodium limit is proper for you.
I love that. I don't know. I'm going to dial into the soul food a little bit with you. I'm, for me, at rolling out, all Black people are special. So I don't have a special set. And I think it's all about taking grandma's recipe, because grandma worked real hard. Mm-hmm. She was up, she prayed. We think, well, meditate. Well, they were meditating when they were praying. So that's a different regimen. I remember I used to wake up and I was like, my grandpa prays so long. Like he'd be down on his knees for like an hour. And that's meditation, because it's meditative for that community. Then they worked hard. They were out in the garden, our grandparents' garden. They had a garden. They were active. So, 99. And obviously, my grandfather's from Louisiana. So the entire time, he ate all pork. He definitely had sausage, but he was also a beans and rice guy. It could just be beans and rice. It could just be eggs and rice. And that was enough for him. So I think they were very, very, very active adults as well. Not only just there with the food, but they worked hard, very, very hard. So it's very different because we've got these sedentary kind of approaches. The other thing is just ad-libbing to those soul food, because I love spicy greens now. So I don't need the salt, but I love spicy. And then those sweet potatoes, don't take my sweet potatoes, but I love roasted sweet potatoes. They're easy. I cut them dollar size. And, I think it's just learning to love. And then there's spices. The other is just meal prep. So you're not on the run and you feel like you can't have something. Make at least 2 to 3 servings at one time and keep it in the refrigerator. And then you kind of know how much sodium, how much salt. But I think we just need to ad lib on those soul food recipes and still enjoy those delicacies that I love with my community. And I'm not judging. I think you eat what you know. Eat what you love, but don't eat to die. Don't let the fork be what kills you in this life. I think beware the fork that has too much. And I think that's part of what you were sharing. So I think culturally, we have to love one another and continue to share joy as we talk about it. Like, not be ugly, not be mean, not be condescending, introduce walking as a community, just talking about the benefits. And then the other thing is having accountability partners. How does health accountability partners play a role in going to the doctor, being there, and sharing your health journey with someone in your life?
Health accountability is key. And I'll tell you, my mother and her good friend, Miss Cha, are walking partners. And they make me laugh because I feel like just about every morning before they do their walk, one is hoping that the other one will say, oh, it's kind of cold out there, let's not walk. But all it takes is one of them to say, all right, let's go, let's get up. And then they're both out there, and once you put the walking clothes on and the walking shoes, you're out there, you're walking, you're socializing, and you're decreasing stress, and you're increasing that physical activity. And so having an exercise partner is just one way where the accountability is good. And then as far as the labs, a lot of times physicians will kind of give you that body language where they're ready to go, and they'll just look, oh yeah, all your labs are fine. Here, there you go. It's important to find someone, and everyone does not have a healthcare provider in their lives, but that's where, that's one positive note to social media, where you can actually Google or look up certain things. Now, Googling does not replace someone else's, medical degree, but there are certain places where you can go and kind of get an idea of what a lab should be or what a lab should tell you. And I know from my YouTube channel at Dr. Frita, I have countless videos where I'm telling people how to interpret their labs. One in particular, CKD stages, chronic kidney disease stages. It seems very complex to really know what CKD is. Am I at risk for dialysis? But like in that video, I break it down. I tell you, when you look at your labs, look at your BUN, your GFR, your estimated glomerular filtration rate, what it means. And I break it down in layman's terms, real simple, but it's just enough so that if you take that information into your doctor, then they're like, oh, this person knows and cares about their health. Let me spend a little extra time. And for the person who does that research, if they will share it with their loved one or their friend, hey, don't let them just tell you all your labs are okay. Ask what your blood count is. Ask if you're anemic. Ask what your cholesterol is. Ask if it's putting you at risk for heart disease. Have your list of questions to ask your physician, because you're not expected to have the answers, and it's not meant to be adversarial, but all you're doing is communicating to your healthcare provider that, hey, I'm important. I care about my health. I've looked up certain things to let you know that I care about my health. And this is my time. I'm claiming my time for you to explain to me in detail. And don't, again, just do it for yourself. You share that information and you then become a health advocate to someone else, whether you're in healthcare or not.
So go online right now, everybody who's watching this video, and check out Dr. Frita, like it, follow her, and definitely share her videos. The value of YouTube is if you have a loved one that needs a little lift, this is that moment to do it and share it from someone who really loves our community. Now, a couple other questions. Everybody needs to know the range. Regular blood pressure. What is that range? What should we know? I'm 200 today, Doc. What's up? Ooh. 200 over 90.
So that's extremely high, 200 over 90. In fact, I think that made my pressure go up when you said that. So I was like, oh my gosh, she's not serious, is he? So yes, no. 200 over 90 is very high. And what's even more important is that some people are at that level and really don't have many symptoms. So let's just break down what high blood pressure is. First of all, what is blood pressure? There are two numbers you're dealing with blood pressure. That top number, or the systolic, and the bottom number, or the diastolic. That systolic is the pressure in your blood vessels when the heart is contracting or squeezing, okay? So that's gonna be the higher or number, that top number. The diastolic number, the bottom number, is the pressure when the heart is relaxed. So that's a lower blood pressure, okay? The definition of high blood pressure changed somewhat recently in 2017. And so what used to be normal is not normal anymore after many studies showing us that these higher blood pressures were leading to more kidney failure, heart disease, and strokes. Normal blood pressure for adults is considered for that systolic blood pressure to be less than 120, and the diastolic blood pressure, that bottom number, less than 80. Now, there are people who are going to hear this and say, oh, no, if my blood pressure were that low, I'd be dizzy, I'd be lightheaded. That pressure is not normal for me. But the truth of the matter is that for so many of us who have high blood pressure, our bodies have adjusted and gotten used to those high blood pressures, but that's not a good thing. The body is really, it's just really a miracle, and it's a genius because it will compensate and make you feel fine at stroke level blood pressures, but the pressures are still damaging the kidney vessels, still damaging your brain cells, still damaging your heart. So less than 120/80, that's what's normal for adults. Again, consult with your physician in case you do have a special circumstance. If your blood pressure, that top number, is between 120 and 129, it's not labeled as hypertension, but they call it elevated. So almost like pre-hypertension, where you need to watch it. And then if that top number, that systolic, is 130 or greater, bottom number 80 or greater, it's hypertension, it's high blood pressure. And then if it's 140/90, then you're at an even higher stage. It's very important, again, to understand that just because you feel great and your blood pressure is always in the 150s/90s, that does not mean that it's normal for you. It just means that there are some different strategies that need to be attempted to get it down. Different people try medications, and so this is another thing I tell my patients, Munson, when you try a medication and your pressure's been very high, for those first 2 or 3 weeks, because your body is used to having very elevated blood pressure, when the blood pressure starts to come down, your body may tell you, oh my gosh, I'm hypotensive, I have low blood pressure. That might make you feel dizzy, fatigued, nauseated, and that can make a lot of patients want to stop the medicine. But quite honestly, you have to give your body time to adjust. And so you may not feel great for 2 or 3 weeks when the blood pressure medicine is starting. And I warn my patients of that. And I say, call me if you're just very fatigued, or if you're feeling lightheaded. Maybe we'll start you at a lower dose and then build up to the dose. But the most important thing is not to stop it cold turkey. And that doesn't mean you're allergic to a blood pressure medicine. It just means that it took your body a while to adjust to a pressure that's too high, and it's going to take your body a while to adjust to a pressure that's healthy. So the high blood pressure, no, I don't. When patients tell me, oh, that's normal for me, that's good for me. No, it's not. High blood pressure kills, and we need to get it under control.
Facebook says walks on the beach, at the same time, hanging out at the ocean. What should we know about self-care and taking vacations? What should we understand about really disconnecting and having meditative moments in our lives in relationship to pressure? What says Dr. Frita?
What says Dr. I'm sitting up here just thinking about the beach and a vacation. That's what I'm thinking about right now. But what I say is that we must understand that self-care is not selfish. Self-care is not selfish. And I know that sometimes, especially with this whole self-love, self-care kick, it can seem kind of like foo-foo, and what are y'all doing? I don't have time to do massages. I don't have time for vacation because I got to take care of business and finish this thing's to-do list. A lot of people have that mentality that self-care is something that's frivolous and unnecessary. But the truth of the matter is, and even some studies have shown, and the American Heart Association supports, that self-care can contribute significantly to your general health. And this is why. When you're a person who takes the time to do self-care, to go on walks on the beach, to get massage, or to sit down and just do nothing, to not worry about the things to do list and to tune everything else out, what that does is a few things. One, it can give you time to take in slow, deep breaths, and taking in slow, deep breaths can lower the heart rate, can dilate the blood vessels, can lower the blood pressure. And also taking that time with the self-care, it can decrease the stress, decrease those stress hormones like the cortisol and the adrenaline, the things that make your blood vessels tight. It can allow them to be loose. It can the blood vessels to dilate. It can make the blood pressure go down. It can allow dopamine to the brain and some of those feel-good serotonins. It can do all of those things when you pause and do self-care. So when you're getting your pedicure, when your eyes are closed, or when you're getting that massage, it's not just frivolous. It's not something that's, oh, you're being selfish. No, the self-care is not selfish, because if we don't take care of ourselves, we are not going to be around to effectively take care of others. And I say effectively because when I look at caregivers, for example, especially my patients who are taking care of parents, elderly parents, or patients with dementia, a lot of times I will see the patients, the patient, with the ailments, that the patient will be very neat, very clean, hair together, clothing together. And I'll look at the caregiver, and the caregiver just looks like they've been just run down. Why? Because they're taking care of everyone else, not taking care of themselves. And some may look at that as a badge of honor, like, oh, you do such a good job. Oh, I don't know how you do it, or you're a superwoman. That's not a badge of honor, because what's happening, if you're taking care of the other person and not taking care of yourself, that makes you resentful, right? That can make you resentful. And if you're resentful, then, and I talk to patients, we have an open dialogue where it's a safe place when they talk to me, where they say, you know what, you're right. And I found myself kind of yelling at my mom, or just kind of just being mad, or just kind of, snatching things from her. I'm like, okay, so then you're not being an effective caregiver. But if you go and take care of yourself for a little bit, you reset, you recharge, well, now not only do you feel better, not only have you helped your own personal health goals, but now you're much more pleasant, much more patient, much less resentful. So understanding that self-care is not selfish is it's a difficult concept for a lot of people, but it's very important.
Let's talk about this last group that you belong to, who tend to have a cape and jump out of windows and jump moms. I mean, you guys are super. You have all the stress in the world. You deliver for the babies. Empty refrigerator, they still eat. You sacrifice everything. What should mothers really know about putting themselves first so that they can better, effectively, as you have said, love themselves and provide love to their families?
What mothers need to understand, first of all, that while there are many manuals on motherhood and how to be a good mom, there's no manual that will give you the exact instructions for your child or your children or your circumstance. And so mothers need to give themselves grace. I know that many mothers, myself included, we somehow think that if something goes wrong, I should have done that differently. I should have prevented it, or I could have done this, or I could have done that. But the truth of the matter is, mothers, we're not perfect. We don't know everything. We're not omniscient. We're not omnipresent. We are not God. We are humans. We are people. We are fallible. And so mothers, we have to give ourselves grace. The other thing is we have to remember that our children, these little people, they're watching us. And they are so bright and so intuitive, and they're learning from us. They watch what we do, and they learn what they should do. So when we're teaching them, how to take care of a house, or how to organize, or how to do bills, or how to cook, or how to study, or how to be responsible, yes, they're watching that. But if we also never take the time to care for ourselves, if we never pause to treat ourselves, if we never show them that we're important enough to sometimes go away or do a vacation without them, if we don't value ourselves, then we're teaching our children, when they're adults, not to value themselves. And so you want your children to model your behavior with all of the, high executive functioning and all the things that, most mothers will agree that kids need to learn, but you also look at the way you treat yourself. And if the way you treat yourself, you'd be very upset if someone treated your child like that, then change the way you're being treated. If you're in a relationship, for example, and the person is talking to you any kind of way, or emotionally abusing you, oh my gosh, physically abusing you, not valuing you, your children are watching. You're teaching them the behavior that's acceptable for them. So I say this to all the mothers who think that they don't have time to take care of themselves, and they have to be here, and they have to be there, and they have to be superwoman. Pause. If the way being superwoman makes you feel, if the way that being superwoman makes you feel, if that's not the way you want your children to feel, if you want them to pause and value themselves more, then you pause and value yourselves more.
That is so beautiful. It's so needed, because moms are so, I consider it abused at this moment, because we expect you to tolerate everything, do everything, fix everything, and then not love you back and give you as much as you need, or even give you that pause to say, yeah, take a day. So I think that is such a beautiful thing for us to learn now as a culture, to love our moms different, to give her flowers now, and make sure that you stop by and say, are you okay? Versus just, I need. So I think that's a conversation, and particularly because it leads to a lot of pressure. It
Mhm.
leads to a lot of high blood pressure. It leads to heart disease. It leads to overeating because you're stressful about food. Can we talk lastly about health triggers, things that people need to watch out for that really raise their blood pressure? Anger, things that are like resentment, arguments.
I think the biggest kind of the overriding trigger is when people obsess about things they cannot change. And so when you're upset about something, when something's frustrated, when a conversation didn't go the way you wanted it to go, or when an interaction happened with a boss or a coworker that didn't go well, or when your kids are driving you up the wall and you just want to sit and talk about it and relive it, and I should have done this, and I'm going to pause. Give yourself a moment to be angry, but understand that that anger will cause you to stress, and that stress can lead to other medical problems, including hypertension, and put you under pressure. So you pause, and then instead of just dwelling or beating yourself up or reliving the moment, you say, what in this situation can I change? So if it's an interaction that went wrong, just all the way wrong, you said some things you shouldn't have said, then think, okay, should I apologize to the person? Should we have a dialogue? If that will make things better, we'll do it. Will I never see the person again because it was a stranger I just told off on the street? Okay, well then you can't change that. But then you think, okay, next time I'm in a situation that's similar, I'm going to handle it this way or that way. And then if it's something that you totally have no control over whatsoever, for example, if you're a worrying grandparent, look, like my grandma, like my mother, and you just want to figure out what all your college age grandkids, your young grandkids are doing, and you want to, tell your daughter and tell your son exactly what they should do. If there are certain things that you cannot control, don't sit there and worry and worry and worry just because that grandson is somewhere out on a trip or on a date, and you're thinking maybe he had a car accident, or I hope he's not drinking, or I hope he's not. Let it go. Give the advice, to your children, your grandchildren, give them that advice, and then you let it go. Because worrying about it, holding on to it, stressing it will do nothing but cause you physical stress, and that can lead again to some of these long-term conditions. So understand what you can change and work on it, but if you can't change it, let it go.
Yeah, those are two of my favorite things. Obviously, the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom no difference. Favorite thing. And then the PJ Morton song, Let Go and Let God,
Yes.
is one of my favorite go-tos. Just, during a week, at least pass by, I play it once, and so that I can know to let it go, or give it up at least, whatever's bothering me. Always, always, always a wonderful pleasure. Name of the book again, for those who are just tuning in.
Under Pressure, a guide to controlling high blood pressure. If you go to drfrita.com, that's DRFRIT, as in take care of yourself, a.com. You can find out how to pre-order it, and it will be available next month.
Ladies and gentlemen, this is Munson Steve with Health IQ, and with my favorite nephrologist and physician, truly a Meharry favorite queen and true healer, Dr. Frita. I'm Munson Steed, and we'll see you all again here on Health IQ.